no ecosystem can be complete with just telemedicine solution alone. See, when we talk of telemedicine, a lot of us talk about the telemedicine solution providers, and we do not understand that for it to be successfully implemented, there is a lot of interface, and at the hospitals end, hospitals do a lot of work interfacing with EHR and HISs, as well as there are nurses and doctors who are using the system. So to give you an ecosystem story, I am going to now invite Soujanya from Shivam Software, Dr. Nuzhat from Fernandez Hospital, and Dinah, who's the nursing head at the Mehta Hospital. The three of them are going to give us the story of an entire solution. So can I invite three of you to give us the complete piece for us? Soujanya, can I invite you?
Sure, Dr. Omar, thanks for this wonderful opportunity. It's an honor to be part of this program. So, while, as Omar has mentioned, nothing would have been possible without a partnership between the healthcare providers, HMISs, and the hospitals. I would very simply explain our success story that in a day-to-day life, in this pandemic times, in a day-to-day life, how did we try to simplify and make it easy for the patients who are not as good as tech savvy to access this telemedicine, and the doctors to be operational in this tough pandemic times. So these are few of our esteemed clients from where I am sharing my experiences, challenges, and success journey of telehealth. Providing healthcare to patients online is usually called telehealth, but to make it operational, it really takes a lot of, to make this teleconsult happen, we need to build a big ecosystem of hospitals with EMR modules, all EMR modules, and the communication network online. We have to build the entire hospital ecosystem online to make sure that we equip our doctors with the required data of all the EMRs and build a communication network using the electronic devices like portals, apps, and TV monitors to make sure the entire data is monitored on the time 24/7 online and are available to everyone to make sure that this teleconsult gets seamless end to end. So the major challenges what we have been looking at when we were trying to get in this is all setup time was actually taking more than what a teleconsult time was required. And the doctors were having many challenges, like how do we actually monitor our admitted patients? How do we save this data, and what is the security that can be given to the data, because these are very personal conversations from a doctor to patient. How can we make sure that we get this data available on mobile apps? And because of virtual, how do we make sure that we give a flawless service with, and keeping in mind the reduction of the medication errors? So for this, get entire data of EMRs on mobile apps and the EMR screens available on web for doctors to access anywhere and any place to consult to make their consultations successful. The teleconsult, which was a very time-taking process, we built in a very two-click consultation process where a doctor has to just click on online consultation within the patient screen, where SMS will be triggered to a patient on his mobile number. And this was integrated entirely into the HMIs, where the system itself would take the demographic data and make a SMS trigger to patient. And second click from patient on the video consultation link would actually put patient and doctor into a virtual consultation room. That the process was so simplified, and it was highly appreciated by the hospitals which were being used. Once the doctor completes their consultation and saves the orders, an automatic prescription was triggered to the same mobile number, and it was made available for patient on screen. Entire communication or the video recording was saved automatically by the system, and it was organized within the patient records. and it was organized within the patient records and was made available for doctors and also on the patient apps for any future reference. And also, as this is a virtual consultation, it was very mandate requirement that we make sure this data is also saved, and but also we make sure that this data is completely secure. So as we are not using any third party medium of connecting networks. This entire data was automatically recorded and very safely secured in hospital services instead of putting it on any third party networks. So the data security was completely taken care. Now, this is all about the outpatients. Now, how do we monitor the inpatients? How do we make sure that the service was also provided and our admitted patients are monitored all along? So the same teleconsultation feature was also used for the inpatients for counseling and monitoring purposes. As soon as the doctor prescribes the medication, these medications were made available on the nursing stations, and patient action charts were derived automatically. The alerts and reminders on every patient level were provided to the nurses, which actually helped nurses to organize their work. And these reminders completely helped, because one of our friends has already mentioned that the medication errors were the biggest cause of biggest cause for the number of deaths that happens every year. So these alert mechanisms have always keep the nurses on toes, and they were helping them as assistants to give a proper medication at the right times. The greatest challenge being everything on virtual, how do we make sure that we have the hospitals and also the HODs and everyone live monitoring the entire operations of the hospitals being virtually located and different locations. So the TV displays, working dashboards, live NABH indicators, live quality indicators were always completely made available throughout the hospitals on the TV monitors, which were stationed on in different units, giving exact scenario of how it needs to happen. And along with this, even the objection management dashboards were displayed in different sectors of the hospital, actually giving them a realistic scenario of entire activities of hospitals were configured based on tags. So making sure that anything which is close to tag and not being attended upon, the HODs are being intimated via SMS notifications, auto callers, in all the ways possible. And once the tags are missed, we had many escalation levels after HODs to the managers to the CEO levels. So all types of tags can have been configured to make sure that the entire operations of hospital run seamlessly. All the data whichever being monitored virtually, I mean, online video recordings, the bills, reports, feedbacks, everything, along with their prescriptions were made available for patient on patient app, so that we have the entire data transmittal model, the same data which is in the hospital records made available for doctors, nurses, and patients every time, any place. So this is how, from a software provider perspective, the technology perspective, the few of the addresses were being targeted, solutions were being targeted in a very simple day-to-day life of an hospital to operate. With this, I would like to hand over it to Diana to let her give her perspective of the EMR solutions provided by us on how it actually helped her uh, in her day-to-day routine life and perform better. So Diana.
Yeah, good evening, everyone. Firstly, it's an honor and privilege to be presenting at CAHOTECH 2020. My name is Diana, in charge nurse ICU at Dr. Mehta's Hospital, Chennai. So early this year, just before the onset of the pandemic, Health Sciences continuous data monitoring was implemented in our ICU, and all existing monitors were connected to integrated with EMR, and an application interface was given through an app. And through this implementation, we were able to observe vital parameter change real time and trends, which enabled early detection, example like deterioration, improvement, and better care planning was done. Remote monitoring could be done by a doctor, nurse, or nurse in charge, which helps with transparent communication and carrying out orders on time. EMR has significantly reduced documentation time and prevented errors by providing the nurse assessment sheet, pending tasks, and graphical trends. And hence we were able to track comprehensive progress journey, which supports decisions around change in treatment plan, and also counsel the members of the family. The data entry could be done on a mobile phone or tab or a computer, which takes less than 2 minutes for an assessment. A major benefit is the time saved for vitals documentation and charting. So before implementing Health Sensei, we used to observe vitals, enter it in a case sheet, and then manually enter an EMR and validate the vitals. So after implementation with automatic syncing data in EMR, we could only validate the vitals, which was only required. And which the time saved was almost 1.5 hours per hour per patient per day. So overall, the technology implementation has impacted positively the nurses and helped us reach multiple outcomes. Thank you.
To hand over it to Dr. Nuzhat, who is head of obstetrics Fernandez Hospital, to let us know her clinical perspective on same.
Dr. Uma, I think I have 3 minutes, if I'm not wrong. If you can just give me, not to throw your program of balance. I suppose so. I have 2 minutes or 3 minutes, and I'm trying to get it back into place. Thank you so much.
You know how to act quickly.
Very true.
Yeah.
So I would first like to thank each one of you for this invitation, the software. And I think, just to cut it short, the challenge of making a person use technology would to make their life easier. And how do we do it? It has to be, I'm going to breeze through my slides and go to what I would like to say. It has to be integrated in everyday work that they are doing. If I can make a doctor or a nurse use it and love the technology and be able to not manage her work without that technology, then we have, done the implementation part. So I'm just breezing through. This is our transfer referral note, my reminders segment. Previously, I would maintain a diary, would find it very difficult. The OT scheduling, the communication between teams was always a fight. It would continue from one to another. How we made sure that we had a communication to and fro and documented that communication inside. We made sure that this referral note was fixed right into the orders. We created templates. They are the ones that make doctors use the technology. One click of a button and you get 10 orders written down to it. Now, another place that we wanted technology to come in is our emergency calls. We were doing about 10,000 births annually, and we attend to 10,000 calls on a daily basis. So this was very essential that we get it into place. The triage was a place, and cutting it short, it had a lot of protocols, very difficult. What we gave them was a remote monitoring way wherein the admin, the different people can take a look at the report, see how many patients are waiting, and supplement that triage unit or get the patients out. IP monitoring became the need of the hour with the COVID coming in, okaying a summary also. So the challenges have been plenty. To cut it short, it helped us to do a phased introduction and create a lot of templates which the doctors would like, and always give a demo that it saves time rather than it adds to your time. And we ran a parallel audit and a feedback. The COVID pandemic was, we have heard about, and Dr. Sangeeta Reddy or the other speakers have spoken, but we did not have any of these pathways prior to March 2020. And today, as a single specialty, a small hospital in Hyderabad doing 22,000 teleconsults, has been phenomenal for us. We allow the patient to take the booking from the website or the app. And one of the major difficulties that we would have was the patient giving me the reports. How do I see her scan? How do I see the graphs? How do I see the images? So we asked them to upload it through the app and then do a teleconsult, which becomes just like real life consultation. We did struggle with the consents and the disclaimers. One of the most important challenge that was helped by Fernandez Hospital, embracing technology a little earlier, was the fact that we had removed the file as well as become paperless in 2016. And this was such a big help that we had complete information and no duplication, and we could move on to telehealth segment of the software or the process very fast. If somebody were to be starting like we did, the way to convince your own team would be, how do you convince them that is a system which is running very well and they don't want to move to a new system? And I would use this one liner, and maybe it will help you, that we have outgrown our system. If you do not, okay, move out of this system into another one, then survival becomes difficult. So telehealth is today a need and an essential service rather than a luxury. And it has been a great collaboration between Shivam Software and Fernandez Foundation to adapt it to our needs. Thank you so much